Good morning and welcome to Mahala Monday. Absolutely fabulous to have you with us today in the middle of September. And oh boy, are we talking about something quite serious. Exciting in so many ways, but more importantly, something everybody really talks about. But first, as you can see, Rhoda and I are not alone today. Yes. So we have a special guest. And when we have guests with us, it just gets better. And it's good, better, best today. So welcome to Mahala Monday. My name is Dougal. As always, before we introduce you to our guest, Rhoda Stoffels, everybody.
Good morning, everybody. Welcome to Mahala Monday, and a beautiful, beautiful day it is, and very excited about our guest of honor today, definitely. And welcome, Dougal. Welcome back.
Yeah, no, good to be back. Good to be back. Now, let's talk quickly about our guest, because everybody's watching this and thinking, ooh, there's a wonderful person there sitting in the middle of them. So the lady immediately to my right is Chantal Botma. And she is here for a very specific reason, because it all centers around what we want to talk about today. So firstly, Chantal, welcome. Thank you very much for taking the time, for joining us on Mahala Monday. It's brilliant to have you here.
Thank you, Dougal.
Yeah. So let's get straight stuck into it. Now, firstly, I want to tell you this is an interactive show, as you know. So we look forward to your comments and questions. But before we go any further, this is something you got to do. You got to like and subscribe. And of course, hit the notification bell as well, as we always say, because most importantly, when we have episodes, you are definitely in line to find out all the latest news. Now, let's start off with this, because and this is a serious topic in so many ways, and that is why expert is here and other expert is there, and Mr. Don't Know Anything is over here. So the point is, the terms health insurance, medical aid, call it what you will, is in a lot of ways, Rhoda, as a bit of a hot topic, and sometimes we don't understand. And as we know, the fields change. There's always new players, and it is something that everybody grinds about. It is all of that. And if you have it, fantastic. If you don't, it is a serious concern. But numbers don't lie. And I don't know if you want to mention this, but I know numbers don't lie, because the difference is there is only a small percentage of the South African population that in fact enjoys this sort of thing. So this is what we're talking about today. But more importantly, we're talking about game changers, new products, and something you're going to love, and that is why she's here. So first up, Chantal, just tell us about yourself. You're a financial advisor, that's where you come from?
Yes, that's correct. I've been a financial advisor for the last 25 years.
Wow.
Oh, wow.
She looks 25.
Ooh, she does.
Look about 25.
Thank you, Dougal.
Yeah. You know, we got to start. So you're a financial, you've been working in that sort of financial field.
Correct.
Operating with anything, like sort of being the go-between when people wanted medical insurance, medical aid, that sort of thing, as well as just general financial advice, annuities, and that sort of thing.
Correct, yes.
So that is what you did. Then you had a light bulb moment. Take us to what is that light bulb moment? What the reason you're sitting here?
I think it was about 2 years ago where I realized that there's a shortfall in our medical insurance, medical aid field. The whole thing was that, as you just said, about 16% of the population, it's only 16% of our population that either has a medical aid, a hospital plan, or albeit then your medical insurance product. And for me, with working through my clients, I realized that it's normally your contract workers, it's your construction workers, it's your domestic workers. Those people cannot afford. They sit for days on end in a clinic, and they just have to be satisfied by waiting. And then the next role comes where they have to then obviously go and wait for the medication. And is the medication correct? So from that perspective is where we came in.
And just listening to you, I think one of the big concerns, and I can vouch for this as well, is always the big question there is price. Can I afford it? How do I actually get that cover? That I don't have to go sit in these queues, I don't have to experience this. And I think the question really, and my biggest fear is also price, because whenever you hear medical aid, you always hear 10,000, 5,000, and that automatically puts a block. And I think that's why our percentages are so low. So how did you basically come between, or that point to cross over to that point, to actually ask me? I'm interested in this, I'll be honest with you.
So yes, the thing for us was getting to a point, as you just rightly said, it's everybody can have a medical aid, but do you have the 5,000 rand or the 6,000 rand to spend on that? And we, as I said, we took about 2 years time out to actually do the groundwork and get to an affordable product that I know that my domestic worker, she's on our plan. Because it's affordable.
Exactly.
And I know that now it's a question of she wants to take a day off, but it's not a day taken off. It's a day that it's literally going to the doctor and she can come back to work. Because the reality is those people, I mean, they work on an hourly and a daily rate.
Exactly.
Yeah.
So stay out of the out of your work for a day. A day's wage is what we can. It's what they can pay a month for our medical insurance plan.
Wow. We're going to get to that. You heard it here, like what a day's wage could be is what you're going to pay for a plan. You heard it here first. Now, I know, of course, it is a sector and a field that changes all the time. And it is something that only a small portion of our population enjoy, these sort of products when it comes to medical aid, health insurance. We're going to delve into what the difference is around that as well. So, as you know, of course, it is always a game changer, but here it is. Your prayers have been answered because I know every household is discussing this.
Oh, yeah.
So, if you've got a question and comment, Chantal and your partners, and I'm saying partners because I'm assuming there's other people involved here as well. You had this brain, you had this eureka moment. You then approached people, other partners who's now involved, and you have now started this where you now selling these products tailor-made. And we're going to talk about that shortly. So obviously your financial experience that you had is what you've brought to the fore. And I know when we spoke earlier as well, you said, this is focused primarily on construction workers. And not primarily, but people from a certain income group who now can all enjoy these sort of products and benefits.
Yes, exactly. We try to focus on your lower to your middle income workers, because that is where our biggest gap is.
It is where the biggest gap is.
It
And on that, because I'm actually now ashamed at all the other medical aid companies, because I see all their ads everywhere, but they don't, because normally
Exactly.
I don't even know how it works. You pay a portion, and then the employer pays a portion, and Father Christmas pays another portion. It is all democrat. But the point is, you must be able to do this by yourself. And when there is an affordable plan, we all have. Because this is what it is. This is what insurance is. And I know not a lot of people like it, but at the end of the day, this is something you can't do without. We all know the challenge is what it is. So you got your partners, and how do you start with this? Did you go to medical practitioners and said, "Listen, guys, come now"?
No, as I said, it was literally about two years back. I sat in a meeting, and this was the biggest thing. Nobody was interested in employee benefits, giving a redundant RA, or people now want to give back and they want to focus on your healthcare. How do we keep our people healthy? Being able to come back and be able to do the job. So from that perspective, me and my partners, we actually buckled down, and we had a few companies. And we have got one that was willing to partner with us, and which is really, really a big player in South Africa.
Oh, wow.
Okay, no, but that's excellent.
Lovely.
That is excellent. So it is called Dr. Health. That is the name.
Dr. Health,
Dr.
yes.
Health, I love that name.
Everybody can get Dr. Health.
Dr. Health. So that is what it's
Dr.
called. You've got to
Health.
go check it out, Dr. Health.
There we go.
So if I'm a member, and but you know what, before we even talk about that, because I know a lot of people will be saying, yes, medical aids. And we're going to get really into the nitty-gritty of Dr. Health and the products that you offer, and why I say services, what it is all about, who's part of the networks and all of that. I know Rhoda knows this, but I don't. What is now the difference between health insurance, medical aid? Is it the same? Look at it as the same thing.
Oh, no, it's not the same thing. So your medical aid is where it primarily covers you for your hospital. So in hospital cover, anything happens to you, you can go to the hospital, okay? And it's a fear in South Africa because not a lot of people actually want to end up in your public sector, your public hospitals.
True.
So it's driven by fear, and you take out your hospital or your medical aid, it's in hospital cover, okay? And then with the medical aid, you can also then attach your savings component where you can have your doctor's visits and all of that. So reality is everybody knows that your savings component runs out
Yeah.
somewhere along the
Yeah,
line. no?
exactly.
And it's normally in the middle of the year, and it's like, oh,
That's
what am I going
right.
to do for the rest of the year? So that is where we come in. So your medical insurance, it offers you your GP covers, your unlimited, let's face it, because when you go to, you dread going to the doctor. It's like, oh, shit, how much am I going to pay now? you know?
Exactly.
And the medication and all of that. So it just takes that away. So we provide your unlimited GP visits, if the doctor prescribes you medication, you can get it over the counter, unlimited. Yeah.
Because you're explaining it now in a way
wow.
that I understand. Because the thing is, when you say in a hospital, the way I look at it is, if I'm paying a lot of money for medical, I don't want to run out of nuts.
Exactly.
You don't want to run out.
Yeah.
I want to go to the doctor and say, here's my card.
Yeah.
Whatever it is they do, they do the thing. The other thing that I don't like doing is when they say, I need to phone them and find out who's I need to get a code. Have you heard this?
I've heard this too.
I'm paying you. I go.
Get the code.
You do the thing. This is what it's about, and then I must be concerned about running out, and then there's other things, the in between, the extra. What do you call it? The gap cover. I mean, and then there's a savings. I'm saving for what? It is all so complicated. Why? And you might not be able to answer. Why has it become so complicated? And I mean, the fact that you've now simplified it or the product offering is just brilliant. Because this is where it needs to come in. Now, I want to stress this. If you've got a question or comments, and I know there's some of them coming through, and Hubert is there. Good morning, Hubert. Good to hear from you. Hubert says, without health insurance, getting sick or injured could mean going without needed care or even dying needlessly.
So true.
And that is hitting it on the head there.
That's
I mean,
right.
there's no two ways about it. That is as straightforward as it comes. So I like the fact that what you've put together when you had your eureka moment, as I refer to it, really just simplifies things. So let's talk about it. I mean, so we kind of know what the difference is when it comes to products that you offer. Earlier, and I want to take you back to it. You said a day's wage.
A day's wage.
Oh.
I want to take you back to it because let's see. So how does that work? Because a day's wage, I don't earn what Rhoda earns. You know what I mean? Rhoda, you know what I mean?
Okay, in your case, maybe a day and a half.
Well, next thing you're going to say 2 weeks. It's a good thing we didn't bring payslip. But yeah, so let's work on it this way. Minimum wage in South Africa. I want to put you to the test here.
Yeah.
Minimum wage in South Africa is 3,500.
3,500.
Is it 3,500?
Yeah,
4,000. Let's go on 3,500. 3,500. So 20 work, so we're looking at 200, 300 bucks.
Yeah.
If my maths is, let's make it 350-ish. Yeah?
Yeah.
That is what we're looking at. What do you offer there?
Ooh, okay.
That's something at
So, for 360, for principal member, we offer unlimited GP visits. We've got your casualty benefit, your in-room procedures, what we can offer. We can offer your acute medication, as you can see, their basic optometry, your funeral and accident cover.
Wow, that's extra.
So this is where we wanted to make it different. We're trying to tailor make it to each client. So most of the other companies will just say, listen, you've got a 20,000 rand funeral benefit or 15,000. But reality speaking, from my experience, funeral benefit cannot be less than 30,000. So that is where we incorporated that. Your funeral cover, your accident cover, basic optometry. So we literally try and give the whole picture to a client.
Wow.
All right, so
like
you
it.
got your GP visits. So if I just go to my regular doctor, that's their basic dentistry. So, whatever is the dentist, we're not talking about...
You're not talking at major
Beg your
putting
pardon.
in
Yes.
those
Yeah,
new
like
teeth and-
funny stuff
all
now.
those
Your
crazy-
meds, your chronic medications. So, in my case, the usual stuff I need to take. Basic optometry, or all of this, and then we've got the few, and all of that for, you said principal member from as little as 300. I get all of that for 360. Me,
360
per month.
per month.
South African rands.
Wow.
South, South
I get all of that for
African rand,
360
360
a month.
a month.
Now, what? And I wanna, we're gonna
I'm
get.
shocked.
Okay. Firstly, I don't believe you. Are you serious? Because that's
That sounds a bit crazy.
It's a
you can't
promise.
get anything for 360, to be quite honest.
And no
Right,
surprises.
yeah. So general. So what if I what if I go to the GP and he refers me now to some sort of specialist person? Do you know what I mean? Whatever specialist that. How would that affect?
So we do have your specialist cover as well. You've got a limit, obviously, for per year, and your specialist cover is 4,275. You'll be covered for at a
Which is
specialist.
which is part of this thing.
It's part of this.
Oh, wow.
Yeah.
Sure.
And there's more. I'm sorry, if you ever watch those
Where's the
infomercials on
paperwork? Let me
TV, stop
sign up.
watching and watch this. This is basically what it boils down to. All right, principal
wow.
member 360. So assume here, Rhoda and I are husband and wife, and we've got 2 children. How
Besides
does
the
it
other
work?
50 that's out there. From
Yeah, how does it
Google,
work?
yeah.
So I'm the principal. I'm assuming now I'm the principal member, or Rhoda, every one of us is. We pay 360. What does the other one pay?
So spouse will then pay 295.
Okay.
That is also inclusive of your funeral cover and your accidental benefit. And then per child, it's 140 rand.
And per child will be under 18.
Yes, under 18.
140.
140
wow.
rand.
So that's so let's make it 360 plus 290 and 140 if I go one, and that's it, and then the whole family.
And then your whole family.
Aha! I've got a trick question. What if I got 100 children? Is there a cut
Hey, there was 50 out there. Now I'm hearing there's 100 children, not 50.
Can I only put on 2 kids? Can I go if I've got 5, 6, 5, 6?
Normally we work in the range of 5 children.
All right.
5 children, but we can always motivate to add additional.
So if I've got more than 5 children,
We can
add. Tailor make.
We can
Oh, wow.
And this is the thing is we are Dr. Health, but we also come with the flexibility from me being the financial advisor and assisting each client. So we can always take a step back and say, okay, fine, this is where we're at. What are we tailor making for you?
Because this is
Wow.
where the general industry lack.
Exactly.
Because my needs are not Rhoda's needs.
We can't put you in everybody in the same square.
Oh, my
Nobody
word,
fits
I
in
love
that same square.
So even
Oh,
if
wow.
I wanted to add a grandparent or Oma or the dog or you know what I mean, like
We can
when
cover you with the dog too. Dog
Where
insurance.
is this paperwork? Let me
But
sign up.
basically what we're
Dog.
saying is you can tailor make it to what I need.
Oh, wow.
What you need, yes.
I'm loving this. And I mean, I just worked it out just for a family of 3, 790. I mean,
700, you did the math?
I did the maths, Dougal.
That's why she's the principal member. Hubert Paulson's got another question. I have a question for your guest. Fun is like health and life insurance. Is it true the older you get, the more it costs? And that is a brilliant
That is
question. Thank you so
actually
much.
brilliant.
Because I pay a lot less than Rhoda. How does it work? How does it work? Is that true? The older I get, because it becomes, and Hubert makes a valid point, it becomes more difficult for a more mature person to kind of get these products.
Cover,
Would that, if somebody of 50 sign up for you now and somebody of 23, would that 50 be penalized and all of that?
So that is what we realized. Obviously, yes, it's an industry-related cost, but we took a stance to say we're not penalizing.
Oh.
We're not penalizing people the older you get.
Oh, wow. Okay, Dougal, I know you're the 15, I'm the 23.
So if
So that
you
sounds
are a
brilliant.
principal member or your grandmother's a principal member, each will pay the same.
Oh, wow.
Because the thing is once again, it's breaking the norm that's currently in the market.
Exactly.
The industry is putting everybody in the square box and trying to dictate to the industry and to clients, this is what you need to have.
Exactly.
And that's what we came in and just said, stop.
Yeah.
Wow.
We can try and change it little by little.
And obviously when we and I want to just take you back, because firstly what you said now is yeah, it's quite groundbreaking, and it is heartwarming and all of that. I want to take you back to what you said earlier. When we look at, let's say the target market for this, if I'm a construction worker and I'm using this as an example, I'm on a site or you know, wherever I am, and there's now injuries, and it's
Just quite common,
yeah, you know what I mean. It's a risky job, isn't it?
is.
Whatever the case is, I don't have to go and wait the whole day at a public service. And let's be honest, I'm not slating public healthcare. I'm not slating it, but there is a
The
difference.
reality.
If I have appointment for 10 o'clock, it's 10 o'clock. You go to a public hospital, depending where you are, you go at 6 today, a.m.
If not 5.
Well, maybe tomorrow. We know what it is, and life needs to carry on. In terms of that convenience, this is what we want.
And just listening to that, Dougal, immediately the bells will go off and I'm thinking our economy. Because once that worker's out of work, it affects our economy. Because if you're out of work for a day, and if you look at our workforce, and especially the workforce that we're looking at the lower end, if they don't work, they don't get paid. So the longer you're out of work, it hits that family, it hits that economy, automatically the whole family suffers, the economy suffers.
Yeah.
I mean, wow, jeez.
And I just want to add, that is why we've taken the stance of adding our accidental benefit to that. This product is your medical insurance product, but we've designed it the way because we care. I've seen the impact of one main principal that passes away or got injured, and the whole family suffered.
Exactly.
So that's why we're adding the accidental benefit, because if a worker, construction worker, if he gets hurt on site and he is out of the job for, say, for example, 6 months, where's the money going to come from?
Exactly.
Yeah.
So that is why we've added the accidental benefit, to make sure that, and for us it is the principal member, but it's the family behind that
Behind
person.
it. Exactly.
And that is what we're trying to do.
Let's get, because I want to just buckle down on what it is. So you've given us an overview on this. What happens because I know I wanted to say you people first, because you medical aid insurance people. And the reason why I'm saying that is because I know when it comes to a hospital, and let's say private hospital, not a public hospital, if anything happens, it needs to be a hospital that is on my providers list. I'm not sure. Part of the network. There's the word.
There's the word.
Yeah, that's the word. Needs to be on my network. The same with the doctor, the GP. How does it work now with you?
So we've got a doctor base of about 5,000 doctors.
Wow.
We are nationwide.
So this is basically all of them. All the
We
doctors.
do our
All
numbers,
the
yeah.
clever ones.
All the clever ones. Yeah.
That's a good one.
With respect. But yeah, so we've got a network of 5,000 doctors. If a client comes, once again, tailor-make. If there is a client that says, but listen, I'm going to this specific doctor, and we realize the doctor's not a network, then from our side, we will approach a doctor and see, do you want to network with us?
Wait a minute. So if I've been going to GP Dougal for 60 million years, I obviously don't want to change the GP because I've got this guy knows everything about me, and he happens to not be on your network with with Dr. Health. I can contact you, and we'll.
And all you give us is your doctor's details. So normally on membership application stage, we will ask, who is your primary care doctor? If it's not, then we will, and you feel, listen, I don't want to go to any other doctor, then we will contact the doctor and contract with him.
Other insurance and products don't do that.
Not normally, no. They prescribe.
They don't go, yeah.
You have to just go to
You
the
have to, and
laser.
that's what I'm
Yeah.
saying.
Boom.
You just got to go to this guy and that guy.
Even though I don't like the doctor, I still have to
Yeah,
go to.
and you can't find them because GPS don't work.
Exactly.
So you can still go to wherever you want.
Yes.
Okay, now that's absolutely brilliant. Do you know what? This is where we talk about. This is why we do the show.
Exactly.
Let's be clear. This is why we do the show. Rhoda spends a lot of time with the producers to go through and find products that matter, but
Exactly.
also that comes from the real need. This is
About
why
people.
we do. This is why we do the show. This is really it. So just in a nutshell, from as little as 360, you get the GP. Just summarize it quickly for us.
You get your GP consultations, you get your out-of-network doctors, you get your in-room procedures, you get basic pathology, basic radiology, you get your acute medication, chronic medication, funeral benefit, accidental cover.
Gee whiz, that's just like,
Yeah, it's a bit cheap.
wow,
It's a lot.
I'm very impressed.
That is absolutely
I
impressive.
think Dougal's
It is.
his wind's been it from his
So yeah, no, this is absolutely impressive because do you know what? And the big thing is this is a ever-changing market. This is a sector, obviously, and this is why I'm saying I'm a bit shocked with medical aid, because I cannot remember a conversation where somebody said, "Oh, the medical aid is wonderful." I've never had that conversation. I don't know about you. I haven't had it. If you've had that conversation, write us a letter, address it to Rhoda. The problem is, you need to have this whole thing, everything you got here, including Dr. Health, obviously stems from empathy. It stems from understanding. It stems from leaning that hand that is much needed. And that is where the change in the market is. And not only that, that is also the shift of the nation, you know, because people will be able to buy into this. And this is what I'm saying. I'm a bit disappointed that some, because I feel like that sometimes, that the big corporates, the big medical aid peoples, they overlooking you.
They
you don't
about
see,
you.
Yeah, you don't see it.
Exactly.
And I'm sure they offer something like, okay, anybody can have it, but it's still a whole rigmarole. It is not tailor-made. It's something I've got to take off the shelf.
Exactly. I just wanted to ask you something, and this is not just looking at our people out there that obviously they don't have medical aid, and say they go into this insurance, basic health insurance, medical insurance. My question would be, say I'm in an area where I'm working out in the northern suburbs or southern suburbs, and my hospital obviously, or where I'm living, because you know with government, you need to go to the hospital where you're living, and this is how government hospitals work. I can't go to Tygerberg, because I need to go to Karl Bremer necessarily. So say something happens to me on the southern suburbs. My address is obviously here. What happens if I'm in this insurance, basically? If I get injured, I'm looking at the construction worker, because I mean they work all over. They don't just work in the area they're living in. What happens to me then? And
also I want to add to that, what if it happens to be in Bloemfontein and I'm here in Cape Town?
Good one.
Curveball.
Curveball.
So we've got an added benefit where if you want to, you can have your accidental cover, your accidental in-hospital cover, and then basically, say something happens to you in the southern suburbs, you can go to your closest private hospital, get stabilized there, and only once you're stabilized, you will then be transferred to the obviously your hospital closest to you. Yeah.
Sorry to go. And why I'm asking that as well, I mean, I was at the accident scene and the ambulance came. There was really a question of where does this person stay? And I'm thinking, guy, this person's going to be dying. We need to get this person to the closest hospital. So, and the best hospital possible. And they were contemplating, okay, where does this group, where does this person, where is their medical, you know, what happens to this person?
Exactly. And one of we had a scenario before obviously joining the plan. One of the construction workers got hurt in Fishhoek, and they had to drive all the way from Fishhoek to all the closest hospitals, right through to Kraaifontein before anybody could help them.
Oh, wow!
And this is what we're fighting against. We're fighting for the people. We're fighting that.
There we go.
Where you are, you need to get help. You need to get help now. And then we can sort the rest out afterwards.
Exactly.
Yeah. Same if you're in Bloemfontein. We'll help you in Bloemfontein, and then you can walk to Cape Town, and then
after you all sort it out. And I know, because the places you mentioned, it is quite a distance to cover. You know, if you're not, maybe we're just using this as a Cape Town example, but it is a rather, it's kilometers.
Yeah.
It's not close. So it definitely is. Listen, everything around this sounds amazing. It is absolutely unbelievable. That is the one thing I must say. Now, of course, it is a fairly new company, Dr. Health. It is all starting now. How do people get in touch? Is there a phone number that you know?
Yeah, I know my number.
And we've got all those details on the screen as well, and that is it. So I know that in the next day or so, and even later today, hours from now, you can definitely just go to the website, which is drhealth.co.za. Also easy, you can just send an email to admin@drhealth.co.za. And then there's also a number, 021, which is on your screen right now, 0005843. Because normally that's what you have. You always see the numbers, dial this number now. Don't dial any other number, you dial this number. 021 0005843. with all that dramatization you see on TV with other players. Don't follow any of that. I'm telling you right now, it's from the horse's mouth straight to you. Take it and go. It is as simple as that. But this is absolutely, you know what, I'm questioned out. I'm absolutely blown away, and all I can say is best wishes to all of this. And thank you. But before we get to that, how do you see, and I know it's a difficult question, but I think it's also the shift. Where do you see the future of healthcare? Where do you see us going to? Do you, I mean, products like this and this offering, this is what we've been crying out for.
Oh, most definitely.
We've been crying out for this. Do you think more people will jump on board now and go, okay, it's more tailor-made, it is more shaped to your consumer?
Yeah, I think I can tell you where the healthcare is going to is what we're aiming at is treating our clients or our patients before. It's creating a wellness mentality to say, you've got the capability, go to the doctor, do your checkups, be well, don't go to a doctor when you're ill.
Exactly.
And that is the mentality that's in South Africa.
Oh, yeah.
We only go to the hospital when something's happened. I only go to the doctor when something is wrong. So future of healthcare, I think, I mean, we've got the capability on our wrists. We can check our blood pressure, we can check all of that. So the future is obviously for me, and what I think what me and my partners are fighting for is wellness. It's client wellness. It's getting our workforce to a point where, you know what, I can afford it. It's empowering them. It's that's what we're aiming for.
Absolutely fantastic. I'm all question now. Hubert's got a comment there for us. It says, this sounds like preparing the umbrella before it rains. And definitely, I love it. Get the masses healthy. I mean, couldn't really not agree more. I mean, that sums it up
I just
nicely.
wanted to make 100% sure before we finish up. So this is not just for your normal, if you got a medical aid, you can as well. You can actually get this as well?
Yes.
Okay, brilliant.
Yes, normally what we do is, you've got your twofold different types of clients.
Yeah.
So the one client is where you already have your medical aid, where you do have a savings component, but you still run out.
Exactly.
So you can add this as a complementary product. And the other one is where you cannot afford anything.
Exactly.
And you can take it out as a standalone product.
Any final thoughts, Chantal? Just contact you. Just contact you. Just contact you. Yeah. Listen, thank you so much for coming in. Absolutely. But Rhoda's got another question.
Yeah. No. I'm quite excited as well, just hearing that, because I mean, this is one of our problems we're sitting with. And this exactly why we have Mahala Monday is because our people out there need this information. If you look at the stats, I mean, like we were saying, 16% of our population have a medical aid. What's happening to the rest?
But exactly that.
You know, what's happening to the rest? And the scary part is as well, we wait till we got a hole in a tooth, or we can't eat, and then we want to have emergency, running to a doctor, having to go see a dentist.
Spending the thousands of rands.
Exactly.
Whereby you can go now, you can go to your dentist, you can have your basic, you can have your checkups. Don't have to worry.
Yeah, no, you don't have to worry. It's
comes down to the.
I'm still amazed by all of this, and all I can tell you is that this is just absolutely superb, and it is absolutely fantastic. All these offerings, the whole product as it is, because it is absolutely brilliant. So thank you for leading.
Thank you.
No, thank you very much.
Please send the paperwork.
Yeah, and thank you for your time and coming to tell us. So there you have it. So from as little as 360 Rand per month for you as the principal member, and of course you can add the children that you have, of course your partner as well, so spouse, all of that. You got the GPs. It's just brilliant. But what you got to do is just remember one thing: 360 Rand.
Exactly.
That is it. That is it. I mean, I'm just, you know,
Amazed.
we have a vast amount of our population, as we know, that unfortunately does not have that. And whatever the circumstances, but here's an opportunity at least for us to put the one thing first, which is the most important thing. And ultimately, that is the health. And by doing that, of course, the ripple effect also to the people who are completely dependent on you. And that is what it's about. So this is definitely a game changer. What you got to do is you got to go to that website. You go to it, go check it out, www.doctorhealth. That is where you go. Definitely go check out all the details. That number again, of course, is 021 000 5843, and that details is right now at the bottom of your screen. So definitely share that details. Go have a look at it. It is a brand new. You've just heard it here, and that is what we do here at the show. We bring you the game changers, the things you want to know, how you can improve your life, and more importantly, build everything up from there. This is what the show is all about. You know it, I know it, and we do this week in and week out. So definitely go check it out. The product is definitely there. I can tell you right now, the call is being answered. So no excuse anymore.
No excuse.
Stop watching any of those other infomercials. This is the one you got to watch and share with your friends. It's as simple as that. Thank you very much for all the wonderful comments that came in. Thank you very much to our guest today, Chantal Botler, as well, that joined us. Thank you once again with Dr. Health. We wish you all the best with your partners as well. And thank you to everybody that has partnered with you as well. They must also be patted on the back as well, from the medical practitioners to everybody else that have partnered with you as well to bring us these amazing things. As always, Rhoda, that is it.
Yes, that's it. Have a fabulous week, everybody, and thank you again, Chantal.
Thank you.
Cheers, everybody. Look forward to seeing you next time on Mahala Monday. Don't forget to like and subscribe and share this episode. And until then, look after yourselves and everybody around you. Bye-bye.
Bye.